ROJoson TPORs, thoughts, perceptions, opinions, and recommendations on instruments for open thyroidectomy, minimalist or maximalist preparation. Which one is a better approach? Backgrounder trigger surgical mission in Borlongan, Easter Samar, February 2025, when we had a lot of open thyroidectomies and limited surgical instruments. Firstly, operational definitions of minimalist and maximalist preparation of instruments for open thyroidectomy. Minimalist preparation means minimum and just enough type and number of surgical instruments needed to facilitate dissection and completion of planned thyroidectomy procedure with a backup preparatory plan to secure additional type and number of instruments when needed. Maximalist preparation, more than the minimum preparation of surgical instruments in terms of types and number, prepared and opened in advance. Most of the time, surgical instruments are not used to the maximum during the operation. List of surgical instruments usually used for open thyroidectomy. The type and number should be justified based on the need of the planned dissection and procedure of the primary surgeon. Scalpel and blade, retractors, pick-up tissue forceps, clamps for hemostasis and dissection, sutures for hemostasis and repair, needle holder, scissors, either suture and tissue scissors, sponges, electrosurgical equipment, suction equipment, sterile water or normal saline, and basins. To repeat, the type and number of surgical instruments to be opened should be justified based on the need of the planned dissection and procedure of the primary surgeon, who should announce them to a nurse or assistant who will prepare the instruments. The advantage of minimalist preparation is the least wastage of resources, meaning surgical instruments, and more open thyroidectomy operations can be done even if there is a finite or limited number of available instruments. The disadvantage is more waiting time for the additional instruments to be brought into the operating table if more and other types of instruments are needed on top of the minimally prepared set of instruments. The advantage of maximalist preparation is no waiting for surgical instruments to be asked by the surgeon. The disadvantage is the frequent non-usage or non-maximal use of open instruments, which could have been used in other thyroidectomy operations. ROJoson recommendations: minimalist preparation of surgical instruments for thyroidectomy, as well as for other operations. However, always have a list of other surgical instruments that may be needed and ready to be opened and used on a standby.